Module 5, NCLEX RN, 4 major categories. Safe and effective care environment. The primary client needs category, safe and effective care environment, includes two ideas. Security and infection control represents 9 to 15% of exam questions. Nursing activities include accident prevention, error prevention, hazardous materials, surgical asepsis, standard precautions and use of restraints. Management of care represents 17 to 23% of questions on the NCLEX RN exam. A portion of the nursing activities included in this subcategory is advanced directives, client rights, concepts of management, confidentiality, continuity of care, advocacy, case management, quality improvement, delegation, establishing priorities, ethical practice, informed consent, legal responsibilities, referrals, and supervision. Physiological integrity. The final client needs category is physiological integrity. It includes 4 ideas. Decrease of potential risk records for 9 to 15% of the exam. Its tested nursing activities include diagnostic tests, laboratory values, and potential for complications from surgical procedures and health alterations and therapeutic procedures. Pharmacological and parenteral therapies represent 12 to 18% of the exam. Tested nursing activities include adverse effects, contraindications, blood and blood products, central venous access devices, chemotherapy, expected effects, intravenous therapy, medication administration, pharmacological pain management, total parenteral nutrition, and dosage calculations. Basic care and comfort represents 6 to 12% of questions on the NCLEX RN exam. Nursing activities included in this subcategory are assistive devices, elimination, mobility, non-pharmacological comfort interventions, nutrition and oral hydration, personal hygiene, and rest and sleep. Physiological adaptation represents 11 to 17% of the exam. Its tested nursing activities include alterations in the body systems, fluid and electrolyte imbalances, hemodynamics, medical emergencies, pathophysiology, and unexpected response to therapies. Health promotion and maintenance. The subsequent client needs category is health promotion and maintenance. These questions represent 6 to 12% of the exam. Nursing activities tested include the aging process, ante, intra, postpartum and newborn care, disease prevention, health screening, self-care, lifestyle choices, physical assessment techniques, developmental stages and transitions, health promotion programs, and high-risk behaviors. Psychosocial integrity. Psychosocial integrity is the third client needs category. Stress management, support systems, grief and loss, coping mechanisms, mental health concepts, coping mechanisms, end-of-life care, sensory perceptual alterations, therapeutic communication, chemical dependency, spiritual influence on health, behavioral interventions, crisis intervention, and family dynamics are among the nursing activities tested.